Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and today's guest is Dr. Elaine James. She is a licensed physical therapist and a certified athletic trainer. She graduated from the University of St. Augustine with a focus on manual therapy. She helps anyone in chronic pain, which is probably half the population, to get back to the activities and hobbies they love without surgery, injections, or pain medication. Elaine started her healthcare career as an athletic trainer, helping college athletes get back to their sport, but since changed her focus to treat patients with chronic pain to get back to life. Welcome to the show, Dr. Elaine James.
Hi, Neil. Thank you for having me.
Well, you are welcome. Let's get right to it. You are a physical therapist, a doctor of physical therapy. Share with us, what that is and what kind of people you help.
Yes. So a physical therapist is pretty much a movement expert. We go through 4 years of undergrad and then 3 years of grad school to become physical therapists. And we can work in all sorts of settings and with all sorts of people and populations. I have chosen to work with patients with chronic pain to get them out of that state of continuous being in pain and not being able to do things they love, and just get back to their regular life and enjoying regular activities.
Yeah, like I said in the intro, that seems like half the population. It seems like everybody in America especially is dealing with chronic pain. Are there any niche areas within that huge market that you tend to work with more?
I do, yes. I tend to work more with females, ages 30 through 60. And some of the chronic kind of pains they have usually relates to either back pain, hip pain, or neck and shoulder pain, which kind of all go together. I see a lot of postpartum women as well, also complaining of hip pain, back pain, and then all sorts of other issues that goes along with that population.
Now, here's a question that's just kind of popped into my head here. You've got a slight accent from South Africa. I'm from Scotland, but do you know if the same kind of issues are prevalent in South Africa as they are here in the United States?
I am sure they are. My mom is actually a physical therapist as well, and that's how I got into this profession. Since a young age, I wanted to kind of follow in my mom's footsteps. But I think they have similar issues, but not quite to the degree and the numbers that they have here in the States.
Because we definitely have a lot of really bad habits in the States, especially now in the computer age where there's, cell phones and laptops and we're not really as active as we used to be. But what kind of challenges are your clients have? What problems are they coming into you with?
Well, usually they come in with saying that they're in pain. So whatever, place that might be. But the real underlying reason is obviously because of the pain, they're unable to do the things they love. So with my patients, it usually ranges from now they're unable to play tennis or go running or play with their kids or their grandkids or travel like they used to. So it usually is, the pain brings them in, but there's always an underlying issue, which is more the goals that I work towards get them back to. Helping with pain is one thing, but getting them functional and, doing everything they want is kind of a whole other story.
Yes, definitely. Dealing with chronic pain is definitely hampering to life the way that you would want to live it. So how do you prevent the chronic pain? What kind of things do you do for them to alleviate that chronic pain?
Well, so usually how I kind of start my evaluation process is I go through a thorough background and medical history to get an idea of some of the other things they're dealing with as well. Then I look at the person as a whole, not just as, somebody coming with shoulder pain or neck pain. And from there, I do a functional movement screen. And based on that screen, I go into more of the physical examination. Most of the chronic issues that I see is related to, bad movement patterns or postures. And so after I see how they move, I can figure out what exactly their impairments are and kind of work on those. So, like I said, somebody that's coming with shoulder pain or neck pain, it could be related to something else. Or somebody with hip pain, it could be something in their ankle that they hurt a while back. So, not treating, just the pain, which is obviously the first goal, is to decrease pain, the reason they came in, but then addressing kind of why that's happening. Again, with chronic pain, it's not something that just happens. There's usually a reason for why that is happening. Yeah.
And, you addressed that what are the root causes maybe? Are there, 2 or 3 root causes that really affect all the pains in the body?
So what I see mostly in all my patients, honestly, is they are not able to breathe properly. So I start most of my patients with teaching them how to properly breathe well and deep using their diaphragm, because that's kind of the root of a lot of different things. With core strength, it can everything's going to be affected if you don't have good core strength. So diaphragmatic breathing is a huge part in that. And also, most people with chronic pain, they don't know how to relax and not be in pain. So then there's also a big mental component to all that. So, but the reasoning for all the chronic pain, I feel like you said earlier, sitting at the computer too much, not being active enough, or maybe, when you have a previous injury and you kind of, play through it or run through it, then something else can get affected and get compensated. So usually it's not just the one area. There's usually an underlying cause with chronic pain. And again, 90% of the people I see, the first thing I work on is deep breathing and just being able to relax. And so their body is not in a constant fight or flight.
Yeah. Let's go into that a little bit more, because that is a little bit different than, what you would probably expect to hear from a physical therapist, is the breathing and the relaxation. Now, breathing obviously is not something that we're really conscious of. We just do. How do we train ourselves to do it properly?
Absolutely. So a lot of people with the shallow breathing patterns. Now, I'm not meaning just regular breathing. Regular breathing we are doing kind of without even thinking. But once you get into the deep breathing, that's when if you're, for example, if you're exercising and now your system is stressed, how do you breathe under those conditions? And most people end up having a very shallow breathing pattern, meaning, their shoulders go up through their ears when they breathe, instead of breathing with their diaphragm and then having some good belly expansion as well. So from the breathing patterns, you can absolutely train yourself. And it's actually, harder than people think, getting that mind-body connection with, activating the sequence of activation that they're not used to doing before. But definitely, like I mentioned, the shoulder pain and the headaches, can be fixed pretty quickly if you just focus on the deep breathing and not using those shallow breathing and accessory muscles.
That is really interesting. The fact that just breathing can cause basically a shoulder pain or a chronic shoulder pain or an injury. Is that correct?
Absolutely, yes. If you consistently breathe in that shallow breathing pattern and use more of those, some of the neck muscles, that can just create constant tension and tightness, and can lead to headaches and like the shoulder pain, like I mentioned.
And you also mentioned relaxing. It seems in today's day and age that we're constantly stressed. We're all tensed up, and we just find it very hard to unwind. What kind of problems does that cause?
Yes. So with that, especially with chronic pain patients, their body is constantly getting bombarded by pain signals. Now, whether that's perceived pain or threat, or whether that's real pain or threat, it's constant state of, like I said, fight or flight. And so if you are unable to relax, your body is unable to heal. So it becomes just this evil cycle of you're constantly stressed and your body can't heal, and now you're in pain, and because of it, you're stressed more. And so unless you can kind of break that cycle, it's tough.
And how do you get people to relax?
So again, it goes back to the deep breathing exercises. So one of the great things with deep breathing, if you do it properly, it stimulates your vagus nerve, which is your one of the nerves that helps with relaxation. So that's more your relaxation side of your system versus the fight or flight system.
So what kind of misconceptions do people have about physical therapists, Dr. James? What do they think about physical therapists, and why do they go to a physical therapist?
So I think the biggest misconception, or actually I think a lot of people don't really know or understand what a physical therapist is or does. I think most people just think that we see, older patients, or after you have surgery, that's when you go to a physical therapist, or you go to your doctor and, they send you to physical therapy. So, in the state of Florida, you actually don't need a physician's referral for at least 30 days. So you can actually go to see a physical therapist for any musculoskeletal pains for 30 days without seeing a physician. Just like you would, if you're sore and you want to go see a massage therapist, or any sort of pain, you want to see a chiropractor. We do have direct access as well. Each state is a little bit different, but in Florida, it is for 30 days. So that's a big misconception that, everybody thinks you do need to go to the doctor first to see a physical therapist. And that's not true. And then I think, like I said, it's just not really knowing what we do. And I think if people kind of understand that we treat the whole body, we're movement experts. So anything with muscles and joints, we can help with that. It's not all cookie cutter. You go in and everybody kind of gets the same program. Especially in the setting I'm in, I can, look at the person as a whole, because I don't take insurance and I am a cash-based physical therapist. So I look at everybody as a whole person, a more holistic approach. And people just don't even realize that, they can go in and see a physical therapist and get treated for the entire body.
Well, let's talk about a couple of those things that you just mentioned, explaining that there. First of all, why do you even need a doctor's prescription to go and see a physical therapist?
So up until recently, that was the law. it was required. The only way that you can see a physical therapist is if you had a prescription from a physician. And recently that has changed, with the physical therapy profession moving into a doctorate program, trying to get more autonomy, more independence, and really be seen as like the musculoskeletal expert.
Mm-hmm. So I guess there's still an issue with the education that people still think that they need to have a physician's prescription before they go to see a physical therapist. What can you do to try and help them understand that that's not the case?
So, patient education is huge, and that is a big part of what I do too. It's just educating, everybody that I see, that I come in contact with, just trying to educate the public, when I'm at health fairs or workshops around Tampa, just trying to educate people on that fact that you don't need, a script to see a physical therapist. But just like anything, it takes time to change what used to be a norm. So I think it's getting better now. Yeah, absolutely. Especially with, I work out of a Pilates studio. So, just being around that setting and talking to all the clients and just educating them on, what I do and what they can see me for.
So let me ask you, what stops people from coming to see you if they have chronic pain and they're not thinking physical therapist? What are they thinking? Are they going to chiropractors? Are they going to massage therapists?
Yes, I believe
why don't they
and
think physical therapy right away?
Right, and it's just because that is, in the past, it's physical therapists were thought of as somebody that you go see after you see your doctor, or needing a script. But now with the population getting a little bit more educated on physical therapy, I think it is moving towards going to a PT, as well, and just understanding, we're very, very, very educated, and you can definitely do a one-stop shop with us.
And what's the benefit of seeing a physical therapist rather than a chiropractor or a massage therapist?
Now that's kind of a well, so obviously if you compare education levels, goodness, this one's tough. The physical therapist and a chiropractor is more in the same realm of education level. So I'm not sure about massage therapy, but I believe you can get a massage therapy license in about 6 months. Mm-hmm. So just with the, PT being a doctorate, and so is a chiropractor. With the chiropractors, their model is different. Their practice model is different. So, and they focus mainly on the spine. So they do other treatments as well, but their main focus is the spine. Versus with physical therapy, we kind of do the whole body.
Right, you're the movement specialists. You find out ways. Chiropractors definitely have the things that they do that they're very good at, and they help, as do massage therapists. The massage is important for that soft tissue, but ultimately you've got to find the root cause, and that's what you do. Find out why they're having that chronic pain.
And that's why, just doing a thorough movement screen and seeing what, where are the movements that could be causing the issue, is very helpful. Now, I do work with a lot of massage therapists and chiropractors as well. And I think, having a team approach and having an abundance kind of mindset is really what, patients need and would benefit the patient. So, if it's a soft tissue need that I can't fix, I am happy to refer to to a massage therapist, and same with a chiropractor. If it's a joint issue that I feel that they're better equipped to handle, absolutely, I'll refer out.
Mm. Now, give me an example of somebody that you have helped. I like to get, examples from people, somebody that springs to mind that's come to see you. What kind of issues did they have coming in? What kind of solution did you provide? And what was the outcome for them?
Absolutely. So one of my most recent patients, she's a very active 34-year-old. Actually, she's a yoga instructor, and came to see me for hip pain, right-sided hip pain, and right-sided shoulder pain. And it's been going on for a while, a couple of months, and she just kind of thought it would go away. And so after doing her evaluation, and she had mentioned in her past medical history that she had an ankle fracture 2 years ago on the right side, which she kind of thought, obviously couldn't have anything to do with her current situation. So after we spoke and I saw how she moved, we realized that her right ankle mobility and strength is lacking significantly. And because of that, that caused a, up the chain reaction to her hip. Because of that, she was, side bending to the side, favoring it, to the point where it went all the way up to her shoulder, where her shoulder was affected because of the way that she was moving. So instead of when she was, going overhead for lifting something or grabbing something out of the cupboard, her hip pain was then, causing her to move a little funny in her shoulder. So for someone like that, the first thing I would work on is her ankle mobility and ankle strength.
Right.
And then, I work on the hip mobility and I, address some of the shoulder stuff, but the underlying issue was the ankle. So by, addressing that first, that can help everything else up the chain.
And, you wouldn't necessarily think that a yoga instructor is going to have issues like this, but, there you go. There's an underlying root cause that even, a fit, healthy person is, still has to deal with. Now, do you see a lot of athletes that come in with problems?
At this point, no, not anymore. I used to work more with athletes, but now, I see mostly 30 to 6-year-olds, and again, so they're very active, and I guess in their own right, they used to maybe be athletes, but they currently aren't on a team or anything like that. But most of the people I see are very active. Like you said, the yoga instructor, you wouldn't think she would be, suffering from chronic pain, because she's healthy and fit, but so most of the people I do see are pretty fit, and so I guess they can say they're adult athletes, or I don't know.
Right.
But I don't see, I very rarely see these days college athletes and professional athletes anymore.
Now, explain to me what manual therapy is.
So within the scope of manual therapy, there's quite a different few techniques that you can use. So at St. Augustine, we focus a lot on joint mobilization and joint manipulation for all the joints in the body, and then also soft tissue work. So that can range from deep tissue or trigger point more to a very light myofascial release. So there's a wide range of manual therapy, which is at this point what I do a lot is manual therapy to address restrictions and limitations. And then I do a lot of give people homework and, just self-empowerment, self-awareness, so they can kind of take, care of themselves and don't necessarily need me for very long.
So believing that you're you're going to get better and you can do what you need to do to get better. That's a very important mindset as well. Now, tell me, Dr. James, you did mention that your mother was a physical therapist as well, but what got you into this industry? Why are you passionate about this?
So I love helping people, and just the desire and, the want to serve and to help people get out of pain. And like I said, from a young age, I was always very nurturing and helping towards others. And then at the age of 6, I went with my mom to work for the first time. And at that point, she was working, I believe, with kids with neurological disorders. And that really opened my eyes to a whole other aspect of the physical therapy. But so just, the passion for helping people.
Well, I really appreciate you spending time with me today and educating us on, what a physical therapist is and how that you help people. Obviously, you have a passion for helping people, and they do not need a doctor's prescription to come and see you. If they have chronic pain, they can come and see you. Any last thoughts that you would like to mention before we go and we get your contact details? Is there anything that you really want to leave our audience with? Maybe a few basic steps for prevention or dealing with chronic pain?
Yes. So I would say with chronic pain especially, don't let it linger too long. If you feel something is wrong and it doesn't go away in, maybe a week or so, go see somebody, because it's always easier to fix an issue when you catch it early on, versus if something's been going on for years of back pain. That's not going to go away overnight. And then, also with chronic pain is, people have to put in the effort and have to put in the work and the want to get better as well. So that's what, the education part is so important with the physical therapy industry, is educating people how they can help themselves.
So often we try and go...
part is...
Yeah, so often we try and go that easy route and we go to a doctor and get painkillers or injections or something like that, but really need to deal with that underlying cause, and that's where your physical therapist comes in.
Absolutely, yes. Obviously, our country has a big problem with, pain medicine. So, instead of trying to get a quick fix like that, spend some effort and time and try to fix it.
Well, we've been listening to Dr. Elaine James. She's a doctor of physical therapy. Dr. James, what is the best way for people to get in touch with you if they need to ask you a question or need to come in and see you?
Absolutely. So I do have a website, and that's www.pureptandwellness.com. My phone number is 813-773-3494. And I'm also on Facebook, and that's Pure PT and Wellness.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show or to listen to past episodes, visit businessauthorityradio.com.